Coming up, we'll be on location at Metro Sleep Center in Waldorf, Maryland, discussing the latest advances in sleep disorder treatment and how they can effectively treat sleep apnea, snoring, and other sleep conditions and eliminate the associated health risks, as well as improving your overall health and wellness with one of this region's top doctors, Dr. Eskender Beyene. Dr. Beyene received his medical degree and completed his residency from George Washington University School of Medicine, and the doctor is widely recognized as one of this region's leading doctors. Welcome, Dr. Beyene. It's a pleasure having you with us today.
Oh, my pleasure.
It's your first time, in fact, on our program. We have a lot to talk about regarding a very important topic, so I wanted to begin, if I may, right off the bat, Doctor, by having you please tell us what some of the most common sleep disorders are, because it's a very prevalent problem in society.
Well, when we talk about sleep disorders, there are two big categories. We're looking at the quantity, those that can affect the quantity, and then those that can affect the quality of sleep. So, for example, for those that affect quantity is insomnia. This is a condition where people cannot fall asleep, or they wake up in the middle of the night and they cannot fall back to sleep. So that's the quantity issue. Then you have the quality issue, where you have different sleep disorders, such as sleep apnea, narcolepsy, restless leg syndrome, periodic limb movement disorder, and so on.
Now, I understand that, as I just touched on a few moments ago, and I appreciate if you can tell us a little bit more in detail about it, but this is a very prevalent problem today. A lot more folks are suffering from these various sleep disorders than they're even aware of. In fact, you told me off camera the number is very significant, and I'd appreciate if you can go into that.
Yes, if you look at some of the most common sleep disorders, like let's take insomnia. 30 million Americans have insomnia, and majority of them are not treated, or they treat themselves from the over-the-counter medications, other herbal things like that. And also one of the most common and serious disorders is sleep apnea. And at this time, 80% of people with sleep apnea in our society are not diagnosed or treated.
That's a significant number, Doctor.
It is.
They're not even aware of it.
Most people are not aware of it, and they haven't been screened for it.
So that leads me to asking you a follow-up on this, and that is, there are a lot of serious associated risks that come with some of these disorders, in particular the sleep apnea, where unfortunately and tragically people have lost their lives and loved ones through this. And I wanted you to tell us a little bit about how, if it goes untreated, how it can lead to very serious or dangerous conditions.
Sleep apnea, when it's left untreated, can cause many problems. One, it can affect the daytime function of the patient, such as waking up feeling not refreshed, because it causes disrupted sleep at night. Other things that it can cause is it can affect the brain function, such as memory, concentration, problem solving, attention. In the long term, it has more serious effects, such as cardiovascular diseases. People can develop high blood pressure from it, and some people who have high blood pressure, they will have medication resistant blood pressure, difficult to control blood pressure unless they treat the sleep apnea. Some people may develop even diabetes from sleep apnea.
You see, these things you just mentioned, most people are totally unaware of that. I was unaware of it until you just said that.
Yes, and there are even more serious conditions, such as heart disease. The risk of dying from sleep apnea in your sleep is 5 times more than somebody who does not have sleep apnea.
Yeah, and a couple of examples that a lot of people are familiar with. The former great NFL player Reggie White died of sleep apnea.
That's cool.
Carrie Fisher, you had mentioned as well off camera to me, was another one. Among her reasons for passing away was sleep apnea. It was included as one of those issues.
That's correct. And many people who are thought to have died in their sleep could possibly be from sleep apnea. Which, was not, diagnosed before. Other things that's attributed to the effect of sleep apnea is stroke. I mean, research have shown that sleep apnea is a risk by itself to cause stroke and death. If you look at the occupational aspect, there were some studies that were done in the year 2000 that showed that, if you treat commercial drivers who have sleep apnea, you could potentially save 920 lives a year that are attributed to accidents, by drivers who have sleep apnea.
Yes,
so there's a public safety hazard as well.
Absolutely, very well said. So there are a number of risks and problems and issues that come from having sleep disorders.
That's correct.
Including some very dangerous ones, unfortunately, as you just told us about. Now, what are some of the typical symptoms that we should all watch for, Dr. Beyene? Because, I know you touched on that briefly by describing what some of those issues are, and certainly we could become aware of those issues. But as far as symptoms, what should we look for?
Symptoms, snoring. Snoring is caused by the vibration when the airway is narrow. Now that's one of the symptoms because it's alerting you that things are getting narrow and they may be potentially collapsing, which is the sleep apnea. Waking up, not having a refreshed sleep is another one. Feeling tired during the day is another sign that could be because of the sleep apnea. And also when somebody tells you, this happens a lot of times with spouses, that your breathing stops at night. This is an indication that there may be sleep apnea that's causing it.
Yeah, where it just stops for a few moments, then suddenly we catch ourselves.
That's correct, like gasping, waking up gasping.
And that's where the significant other can notice that because
that's correct.
It's very obvious.
That's correct. And some of the diseases like high blood pressure is one of now big indicators that for someone who has high blood pressure needs to be screened for sleep apnea because that may be contributing or making it difficult to treat.
Very interesting. Now, how do you diagnose sleep disorders, doctor?
Now, sleep disorders, besides history, some of the disorders can be diagnosed by history or physical exam. However, if we take sleep apnea, we need a sleep study. Now, this can be done at home, home sleep study, and most commonly it's done in a sleep center like ours here, where the patient comes in the evening, spends the night in a sleep center, where we attach monitors in the head so we can see the different stages of sleep the person goes through, and we can actually see how many times the brain is waking up and what may be waking up the brain. There are sensors to detect apnea, for example, when the airways start decreasing or stops. We monitor the heart rate, oxygen level. So that's more comprehensive study where patient spends the night in the sleep center.
Yes.
And then they wake up in the morning, they go home, and then we analyze the data, what we gathered during sleep.
After you're monitoring them during their sleep.
Exactly.
With all that technology that you have here at your center.
Exactly.
And then you gather that data, you analyze it, and then that helps you determine what the next step is, how to help that patient.
That's correct.
And as far as the patient process, as far as that goes, doctor, from when they contact you, for those folks watching right now, they initially contact you in your practice and they set up a consult, right?
Yes.
And that's when you go through the different options and everything that would be in detail to help them.
Right. So, the patient may directly call our center to make an appointment, or they'll be referred by the primary care physicians, by their cardiologists or endocrinologists, other doctors. So we see them in the clinic. We go through the history. We do a thorough evaluation and see what sleep disorder may be going on. And then if it's indicated, we schedule them for the sleep study and they come back to get the sleep study done.
Okay. Now, is that just one time or it depends on each patient where they may need to spend a few nights here?
Usually it's 1 to 2 nights,
okay.
Depending on what we find on the first night. Some people may have to come back for the treatment aspect where we find the right treatment. If it is, for example, CPAP, to find the right pressure, the right mask. Usually it's 1 to 2 nights.
Now, we touched on this briefly a moment ago, but you certainly, your practice here, Metro Sleep Center, utilizes the latest state-of-the-art technology, the equipment that you have here to really help address these sleep disorders and customize the appropriate treatment plans. I wanted to ask you if you can tell us a little bit about some of these technologies and how exactly they work. I know you touched on that briefly, but if you could elaborate a little bit, Doctor.
Right. So, one of our mission is, once we diagnose somebody with sleep apnea, is not to leave anybody untreated. So, the main treatment has been CPAP, for example, for sleep apnea. And there are people who cannot tolerate CPAP, for example. And in those cases, we have other modalities. We use oral implants. These are devices that the patient can use, at night that can treat sleep apnea. But also, over the last 4 years, we are one of the first centers to provide the Inspire. It's a small pacemaker that is implanted that can actually treat sleep apnea. And in that case, the patient does not need CPAP, for example. And we give them remote control that they turn on the pacemaker and sleep and turn it off in the morning. So, these are some of the latest technologies that we use in here.
Yes, and as far as how their perform goes, you detailed that for us already here. But I wanted to ask you, how long does a treatment typically take? And I know that depends on each patient again and his or her situation, but in general, for folks out there watching, what would be the typical length of time for a treatment to help them?
Right. Now, that's going to depend on the type of sleep disorder they have.
Yes.
And for insomnia, maybe a few days, few weeks. For some of the other sleep conditions, medication may be taken indefinitely, like for narcolepsy, for example. For sleep apnea, the treatment, for the most part, is indefinite. If it's CPAP, the patient wears it every night.
Yes.
However, there are occasions where, if the patient loses significant weight, that may change. But also in the pediatric population, many times that if they have sleep apnea, once they have surgery to remove the tonsils or adenoid, that may cure it. So there are occasions where it's cured, especially in the pediatric population, but for the most part it's indefinite treatment.
I appreciate you telling us that. And what type of results are your patients seeing from coming to you?
One of the things that differentiates us from other centers is we believe in patient education. So from the day they come to our center, we really spend time educating them on what we're looking for, how we're going to test it. And once they're diagnosed, we also educate them what it is and how it impacts them, how we will treat it. And for the most part, most of our patients are very appreciative for that, and also they tend to stick with the treatment, and we follow up with them very closely to troubleshoot any issues they have with if it is CPAP, for example, with the mask or the machine. And with our compliance rate, for example, with the CPAP is way above the national average.
As a follow-up, I wanted to ask you, Dr. Beyene, how can some of these technologies that you just discussed, how do they really benefit the patients? Can you tell us a little bit more in detail about that?
Yes. So let's take the latest technology with sleep apnea, for example. The purpose of the CPAP is to push pressure in the airway to keep the airway open. Now, normally during the day when the brain is awake, it's the brain's job to keep that open. So the brain basically sends a message to the airway muscles to contract and open the airway. Now, the problem comes at night. So that's when the brain is sleeping. Those messages are not transmitted to the upper airway, so the airway collapses. That's sleep apnea. Now, one of the latest technology that we're using is the pacemaker. Now, the pacemaker, for the if the patient meets the right criteria for that, after we screen them, it is placed on the right side of the chest. A very small device. It's placed right below the skin. It has a small wire that below the skin goes up to the neck. and gets attached to a nerve which is used by the brain to open up the airway during the day. So nighttime, before the patient sleeps, they turn on the device. So it sends microelectrical stimulation to that nerve, and the nerve in turn activates the muscles to open up the airway. So basically what it's doing is it is taking over the brain's job at night when the brain's sleeping.
Exactly. So that issue doesn't occur as a
Right.
result.
So the airway is open and oxygen flows uninterrupted, and the brain is happy, sleeps uninterrupted, because it doesn't have to wake up to keep opening the airway.
Exactly. Very interesting. You're getting some very strong results. Obviously, you just said above the national average as far as the patients that come here, how you're customizing the appropriate sleep disorder treatment plans for them. You're doing some great work and helping a lot of folks. So you have people coming from all around the region to you, doctor.
Thank you.
Now, we're literally out of time, but I wanted to ask you, before I let you go, Dr. Beyene, you and your practice, Metro Sleep here in Waldorf, Maryland, have certainly established a reputation for excellence, not only in sleep medicine, but also in effectively treating sleep disorders and patient care. You and your staff here, you have a lot of folks that love you guys and are referring family and friends and people they know to come to you, because sleep disorders are so prevalent, as we touched on at the beginning of this interview, affecting a lot of people in many ways, including their quality of lives and their loved ones' lives, who have to have a grumpy people who aren't getting much sleep. I wanted to ask you, Dr. Beyene, if you can please tell us what you feel help separate you and your practice apart from many of the others.
Yeah, as I mentioned earlier, I think patient education is one of the big ones. We truly believe that an educated patient will be more informed about their condition, more likely to follow treatment recommendations. So that's one of the things that we use here is, we use models, we use pictures to educate our patients on what the condition is and the treatment.
Yes.
The other aspect that separates us from other centers is we use the latest technology. We're always keeping up with the latest technology. Yeah. As I mentioned, like Inspire, for example, we use that for sleep apnea. And we have other devices that we're using for insomnia, for example. These are cranial nerve stimulation devices that are FDA approved for insomnia and anxiety and depression. These are non-medication treatments. So we are always keeping up with the latest technologies out there that are FDA approved.
Yes, all for the benefit of your patients.
Absolutely.
And on that note, we'd like to thank you, Dr. Beyene, for joining us, educating us about this very important topic. And we'd love to have you back on in the future, in fact.
Well, my pleasure.
Thank you.
I had a hard time driving. When I was at lights, I put my car in park because I knew I would fall asleep. I'm like, something's really wrong with me. I went in and I did have severe sleep apnea.
At work, I'm forgetting to do simple things that I used to just keep on top of.
I was always looking forward to my next nap. That was my goal in life, is to when can I lay down?
Before I even left from the sleep study, they fitted me with a machine.
You're tethered to this 4.5-foot hose, having something airtight on your face, and then you're supposed to relax and go to sleep, which was really a struggle for me.
I just happened to go online and see this ad about Inspire, and I thought, oh my gosh, I need to look into this.
The more I read, the more excited I got. And instead of feeling defeated, I felt hope.
Once I met the Inspire team, they helped me with my insurance. It was one-day surgery. It lasted about 2 hours.
Recovery was very smooth. I had no pain.
This little device here is the brains for the Inspire implant.
You put it up on your chest, hit the little green button, and it'll turn itself on. Once I wake up in the morning, it's the same thing. Put it right back up on the chest, and it turns itself off.
There's no mask. There's no device to put in your mouth. There's no machine that you have to clean.
Where before I was constantly changing the alarm. I need to sleep as long as I possibly could. Now I'm like 5:30, I'm up and about.
At work, I'm much more back to normal. I've since enrolled back in college, going back to school to get degrees again.
I'm back to kayaking. I'm back to riding on the back of a motorcycle.
My granddaughter's in theater. I no longer fall asleep in her plays.
I realized, oh my gosh, what a change this has made in my entire life.
You're relaxed, you feel good, you're looking forward to the day. That's how I feel every day now.
I have a whole new outlook on life again, being happy and being able to do everything I ever wanted to do again.
It's not only changed my life, but I honestly think Inspire saved my life.
For 14 years, this is what I actually slept with. Now, this is what I sleep with.